also, so you could put slides, please.
Thank you very much, Remia. Let's wait for the slides, then I'll start. Thank you. So welcome everyone. Good morning, good afternoon, and good evening, wherever you are. Happy International Women's Day. We are so happy and privileged to have you all with us today to celebrate International Women's Day with us, ADRRN. Next slide, please. As you all are well aware that it started in 1911 when women started asking for our rights, and it was declared, 8th March was declared as a Women's Day internationally. From there, so on started, and working on different issues of women were started from various organizations plus governments. So far, we do have amazing recognition of women achievements and advocacy for gender equality all around the world. This year, our theme is Gender Equality Today for a Sustainable Tomorrow, and we have tried to link it with our mission, ADRRN's vision and mission for sustainable development and resilience. As you all are well aware that, and research also say that disasters often exacerbate existing gender inequalities and affecting women and especially vulnerable groups in various ways. Women face higher mortality rates during disasters and after disasters. However, their contributions are underrepresented in various policies and programs around the world. Next, please. When they are included, researches and practice has shown that we possess amazing insights and knowledge around disaster risk reduction. We work as a caregivers, leaders, knowledge holders, and we do crucial role in disaster risk reduction during and after disasters in the communities and elsewhere in the society. So we do believe that women participation in DRR leads to comprehensive and effective recovery strategies that benefits everyone. So keeping in mind all these realities, we do have this webinar today, and we have arranged this webinar around all these realities. Next, please. So today's webinar's objectives are to showcase initiatives led by women that have successfully enhanced disaster resilience. We do have amazing case stories, and we do have leaders who have already been engaged at the ground level, who will share and listen and learn from us today, from all of us, and we will hear from them as well. The other objective of this webinar is to foster discussion on strategies to ensure the inclusion of women voices in DRR planning and implementation across the board. It's not limited to state, but it is from grassroots to all levels of disaster risk reduction. Also, we believe that with this webinar, we will be able to encourage participants to take actionable steps towards promoting gender equality in our communities and advocating for women involvement in disaster management. Since International Women's Day asked for accelerate action, so we do believe that today all of our participants will have something as a takeaway to do more for accelerate action. And our another objective of this webinar is to call for action to invest in women, because we do have strategies in place, we do have policies in place, but there is always issue of budgeting. So we are calling all the stakeholders to invest in women empowerment and inclusion in decision-making processes to create equitable and sustainable solutions. Next, please. To achieve these objectives for today or this webinar, we have lined up some activities around these. So first, we had a welcome and introduction session. Rimia is handling all the webinar and taking care of all the webinar. We do have amazing keynote speakers at Takeshi. Our chairperson is with us for keynote address. After that, we will share a video documentary around how women, and especially in different circumstances, how women are leading disaster risk reduction activities on the ground. Plus, we do have an amazing panel discussion from the ground. We will hear leaders discussing around the innovative approaches to empower women in disaster risk reduction initiatives. Plus, we will also discuss how these challenges are affecting their work. But at the same time, with the issues, we will hear about some actionable steps plus solutions that they are doing on the ground. After that, we do have question and answer session. We will love to hear our participants about your work, about your insights around our topic. And at the end, Kathy will actually summarize the session, and we will end the session at 2:30. So thank you very much for hearing. So I'll ask, I request Ramia to come in and then take the webinar forward. Thank you, everyone, for listening.
Thank you. Thank you so much, Kosar, for beginning this discussion for today. And I would like to now invite Mr. Takeshi Kumino, who's the chairperson of ADRRN, to share his keynote address.
Thank you, everyone. And it's great to be here, and happy International Women's Day, which is tomorrow. My name is Takeshi Kumino. I serve as the chairperson for ADRRN currently. Before I start, I would say that one of the big focus of ADRRN is about our pursuit to the resilience movement in Asia. And women's leadership and women's role cannot be forgotten or overstated in such endeavor. Very important indeed. Now, our vision that we have as ADRRN is currently Asian region is often said to be one of the most disaster-prone region in the world. We would like to transform the region to the most resilient region in the world. In order for such transformation to happen, it's not really about implementing projects after projects, but it's really about the transformation of how we live. It's about the daily decisions of those who live in this region, and that's why it's a movement for us. And women play a key role in creating and sustaining such resilience movement from our perspective. Sendai framework that we all try to adhere to teaches us how to look at gender issues from more systematic perspective. So from understanding vulnerabilities and capacities, as Kosar has noted, all of society engagement, reducing the losses of the communities, and investing into local leadership for early and anticipatory engagement. This is also evident from the 2024 CSO commitment that we have presented at the Asia Pacific Ministerial Conference for Disaster Risk Reduction. We've done this after extensive consultation in the region. And I would also like to draw your attention to particularly point number 2 on capacity sharing, because there is a significant level of capacities at various forms that already exist, which is demonstrated by various leaders also who are online today taking part in this event. We've seen that in the local leaders. We've awarded at the APM-CDR amazing transformation that these women leaders are pursuing. We also heard from them about their journey to be a leader, to be an innovator. They are not born as an innovator or leader, but there was a process for them to become one. And the society and the community around them have played a role in uplifting their leadership character for them to reach where they are today. We've also seen the local nurses who were awarded last year, who demonstrated the significant leadership to transform their disaster-affected communities. So it's not only about the service provision that they have done, but they are really transforming their communities. And that's what I feel very amazed of these individuals that we were fortunate to engage with. And of course, I cannot forget the leadership characteristics as such are also evident from our all-women secretariat team of ADRRN. They are really the ones who's driving change. ADRRN has gone through a sea change of how we work. And our secretariat colleagues are really taking on this transformational role. And of course, we should give thanks to our colleagues who are also on the call today, but who are part of this program that we implement called SIDRA, which is funded by SIDA, managed by colleagues from IRC, and implemented together with Drug Nivran, PBSP, and also IRC Thailand colleagues with partnership with many others. With the support from this program, we are really able to drive this change from the Secretariat, and I give thanks to all of them who are engaged in this process. I think in order to move towards our Vision 2030, there are still homework that needs to be done from our side. So understanding the actual risks from the contextual vulnerability and capacity assessments are required. It needs to become a norm. It should not stay something special. Cross-sectoral partnerships are required for tangible change and tangible impact. And things really need to be embedded in our daily lives. It should not be something, DRR, our resilience should not be something special, but it should be something normal. And I think it's time to recognize and celebrate the leadership demonstrated by women in the region. And also remind ourselves that we need to ensure the support structures in our community and society for them to implement their leadership on the ground. It's not done by them alone, but it's done collectively. So I thank you very much, and I look forward to today's fruitful discussion. Thank you everyone for participating. Over to you.
Thank you, Takeshi-san. And thank you especially for reminding us that all of us are in some way catalysts in creating this movement of resilience. And keeping with this thought, we now have a short video that will take us through some of the grassroots innovations being taken forward by women who are leading these movements of resilience in their communities. So if we can have that video. Being, how do we innovate sustainable and impactful solutions? The answers to some of these questions lie with the very communities that are already feeling the impact of climate change and disasters. Lived experiences, collective histories, and indigenous knowledge are powerful catalysts for effective and relevant locally led innovations that address existing and future risks. As an inclusive approach to humanitarian response and disaster risk reduction, the Community-Led Innovation Partnerships Project champions locally driven solutions that stem from grassroots knowledge and practices. What can a community do when they are battling with flooding and crop failure? Flooding when it rained led to accumulation of waste, and crop failures during dry months resulted in decreased income. These situations led to an impactful innovation that addresses multiple climate change challenges. To deal with this, community members started composting organic waste using stacked buckets and maggots. Women in the community led the process. transporting and depositing collected material to the waste bank was done by the youth. Reduced waste in the community reduced waterlogging, and the profits gained from waste collection helped combat shortages in income during crop failures. Income from waste management is divided and used to provide basic necessities for underprivileged locals and to buy provision for additional nutrition for senior citizens, toddlers, and persons with disabilities. Moreover, organic fertilizers from the waste that is collected can slowly heal the soil and improve farming in the future. Kununkidal residency in Yogyakarta Special Region Province often experiences drought during the dry season. Shrinking water resources and falling agricultural incomes led to difficulties in cultivation. Because of this, the community did not have enough sources of nutrition. This is when a group of creative women devised a unique solution. Used water gallons were recycled to cultivate catfish, kale, pak choy, and celery. This innovation made way for nutritious diets, while aquaponic technology aided in increased cultivation. Recycling of water gallons also led to a reduction in waste, which was often the cause for waterlogging in the community. South Upi in Maguindanao, Philippines faces the brunt of both natural and man-made disasters. One community here was struggling with limited access to healthcare due to flooding and drought. Additionally, armed conflict led to an increase in gender-based violence. To address this collectively, a group of resilient women set up a center for natural remedies, affordable herbal medicines, and psychosocial first aid. This innovation focuses on holistic wellness led by a traditional healer who merges traditional healing products with modern methods. The center also serves as a hub for disaster risk reduction. As a result of this innovation, the indigenous women in this community have stepped into the roles of healers and protectors.
Yes.
Rescue and relief efforts during disasters often do not respond to the needs of people with disabilities. The absence of accessible transportation leads to day-to-day challenges. During disasters, the situation worsens, with evacuation becoming a daunting task. With the aim to find a solution themselves, a group of committed innovators decided to modify an L300 van that is used for public transportation. The modified van can be used by people with disabilities to access essential services like education, healthcare, and employment. These innovations are examples of resilience, strength, and collective action that are possible when community members design and lead their own solutions. By championing sustainability and ownership, these local community-led models are all about the people who drive them. These innovations bring communities together to inspire collective action. Their aim is to have lasting social impact and shared prosperity that extends beyond their immediate community, making way for happier, healthier, and a more sustainable future. I hope you all enjoyed the film. Hats off to these women who continue to lead these innovations and who are also inspiring other community members while they are becoming agents of change. We're now ready to begin our panel discussion on accelerating action, best practices, and success stories. For this, I would like to first welcome and introduce our panelists. We have with us Agnes Meiria Manggo, who goes also by the name of Mia. She's the program manager at YAKKUM Emergency Unit in Indonesia. Mia's areas of expertise is in locally led inclusive resilience building, focusing on the priorities of the most at-risk groups and strengthening grassroots women leadership. We also have with us Shotiwat Charoenpol, who goes by Tom. He is the Protection and Empowerment Coordinator at the International Rescue Committee Thailand. Tom specializes in Thai legal frameworks, protection empowerment, and mainstreaming protection strategies across programs. I would also like to invite Ms. Zulekha, who leads the Gender and Child Cell at Pakistan's National Disaster Management Authority. Zulekha is a seasoned international development consultant who specializes in gender, communication, and disaster risk management. I would like to thank all of you, all the panelists, for being here today and for bringing your expertise to the topics we'll be discussing. We will first hear from the panelists, and then we can move. We can open up the floor for questions. So to begin with, we would like to look at the topic of how innovative strategies that have proven what are the innovative strategies that have proven effective in empowering women and different vulnerable groups within DRR initiatives, and how these approaches can be scaled to ensure broader community impact. I would like to take this point to Tom and see if he could share some points on this.
Okay, thank you so much. First, do you hear me clear?
Yes, we can hear you.
Okay, good. Okay, thank you so much to give us the opportunity to give to present and also share what we have to do in IRC Thailand, particularly in the area that we're working. First thing, when we receive this kind of the question, we talking among our team, what's the meaning of innovative strategy? We thought that when we're talking about innovative, it mainly related to the new technology, the new idea or the new technique of the world. But once we come back and carefully thinking about what we are doing here in Thailand, we found that innovative strategy in our meaning is mean we bring the new idea to the community. We bring the new way of thinking, of thoughts to the new community to improve their knowledge, to improve their power and share our power together. So today we will come to talking about our success story when we knew to bring the new idea or the new knowledge to the community and let them believe in their project to make it more powerful and impact to the community, particularly when we're talking about the women and vulnerable group. And this is come from the last project that we're working in the deep south of Thailand. We got the information and also lesson learned from this project. Next slide, please. So in this project, I will give you a little bit of background of our project. Actually, our project is funding by at that time is the EU, and we are operate in the deep south of Thailand in 3 provinces. It's basically Yala, Narathiwat, and Pattani. Why we select that location? That location they have quite challenging in many areas. First, of course, they have the disaster. Flooding happen quite seriously every year in this area. Second, the 3 provinces they have the most poorest city or the province in the Thailand. And the third, the political issue in the deep south is not stable. So with the 3 conditions, it make the people, particularly the women and the group that we identify as the vulnerable, have the most vulnerable among Thai country. So that's why we select this place. And when we come here, we try to introduce, and we try to learn from them first. We try to do assessment. We try to do many kind of dialogue with those people. And we found that, okay, the new innovative thing that we would like to bring and let them understand is about 2 issues. The first one, protection mainstreaming. How can we ensure that in every action that we are doing, they realize and they understand about how protection play the vital role or important role to improve the service available, particularly when we're talking about DRR. And the second thing, we would like to bring them to be more understand about the wording intersectionality. Because when we're talking about vulnerable group or women group, people in the deep south in that time, they thought that every women are vulnerable. When we're talking about vulnerable group, they identify, they said that elderly, children, people with disability. Then we're challenging them. Is this true that the women, every women are the vulnerable? If these women are rich, come from the rich family, come from the very good education, they still be rich, they still be vulnerable. If the children or elderly people stay in the good family, their family member taking care very well, they still be vulnerable. This is a thing that we try to identify to those people that we are working with, that every people, they have their own need and their own capacity, and they need to be bring it to consideration. It doesn't mean that we have to take care or to provide the support to everyone in the same thing. That is a two approach that we try to bring innovative way, at least for that community, this new concept for them, to thinking carefully about that and how can they create to the new approach or the new way of thinking or the new way of preparing them for the disaster. Next slide, please. The one of the success story is about we provide inclusive capacity building with intersectionality and protection focus. We working together one of the district at the best practice at the area that we would like to bring into the example for other provinces, that we would like to do the kind of the evacuation plan, support plan. And we're talking with them, and they said that they always said that, of course, when we do this kind of the plan, we invite women, we invite the youth representative, we invite the disability people to join us. But when we come to observe them, we found that most of women, children, or people with disability, they keep quiet. They be there, but they're quiet. Then we just come and talking with them. Why you didn't say anything? They have two issues that we found out. First, they don't know what to say. They don't understand what it means for disaster reduction. And second, they thought that they don't have power or no one will listen to them. This is the thing that we found. And then we have to bring up the concept of protection mainstreaming to ensure that everyone can access, to everyone can share, empowering them. To empowering them is not just only give them the knowledge, but we have to ensure that we have the space for them to share their opinion, and their opinion is being recognized. So it means we need to working together, both sides, with the vulnerability, with the women group, and at the same time, we need to let the authority to understand why this is important, to make a people present in the forum, to make women, man, boy, and girl, make present in the forum. It doesn't enough to show that this is already inclusive enough for everyone to inclusive enough to decide or to make this plan inclusively, or ensure that everyone can be access to this plan. So we end up that we take around 6 months, at least 6 months, to working together with both sides, with elderly group, with people with disability, with women group, to understand what is DRR mean and how can they play the role to be a participant.
Sorry to interrupt, but can I request everyone else to be on mute, please? Thomas.
Thank you so much. Okay. Yeah, it takes us about 6 months to provide this kind of the assistance or working together with them to empower those groups to share what they thought. And when they share their thought, it doesn't mean that they have to share in the academic way. They share what they want to say, and they feedback what they want and what they like or not like. And at the same time, we try to ensure that authority, which is the Thai authority, accept that in the plan. And then we success into the plan that we have the evacuation plan together. We have the kind of lesson, driving lesson together with them. We do the mapping to ensure that people who have the difficulty of movement or people who have the vulnerable group have the way or have the spatial way to support them or to evacuate them during the disaster. And this one, we present that into when we have the end year report to the authority of Thailand. We show this one and we got a very good feedback from the authority. And we saw and they understand that just let them present there, it is not enough. Just let them sitting there in the committee is not enough. We need to make sure that everyone understand and have the power to say what they are. This is one of the best practice and innovative that we share. The second one, the next slide, please. The next slide is one of the best practice when we're talking about intersectionality. As we told you before, when we talk about intersectionality, it doesn't mean that everyone have the same need, everyone have the same capacity. Even among the vulnerable group that we identify they are vulnerable. For example, for us, we identify people with disability is vulnerable. But you know, when we do the assessment, when we're talking with them, when we're talking with many people of them, we found that among the disability people, their hearing impairment is the most difficulty to access to the service. Because people thought that, because it apparent, no one know that he or she have the hearing impairment. So it means many times they've been ignoring or people just forget them when the disaster happened. No one just realized that they didn't know whatever, because when they announcing of the disaster, they were announcing by using their what they call loudspeaker in the community. Of course, those people with the disability impairment, they cannot hear. When we're talking about that, and when we found out that the people who have the hearing impairment is one of the most difficulty, the thing that we do is we bring this up issue to the community. We're working together with the community. We are not the person who told that you should do that, do that, do that. But we are the person who come and facilitate them to create what is the platform, what is the referral system, what is the method to ensure that people of hearing impairment can be accessed to the service, or at least they know what happened when the disaster announcements. And in the side, you see this kind of the diagram. Sorry, this is in Thai, but this is diagram show about the referral system or the way that we will do. So in that time, we collaborate with the university, create this kind of the, what do you call, I'm not sure in English, the lighten warning. So it means that apart from the announcement through this loudspeaker, they will use the light in the very specific color. I think if I remember correctly, it will be orange or whatever, I cannot remember. When the light is on, people who have the impairment, hearing impairment, will notify, okay, this is the thing that they have to alert and they have to prepare. And to be that, it doesn't mean that people impairment will see the light, but it remind other people in the communities that, okay, when we see that light, we thought about people who have our neighbor who cannot hear. We need to notify them. They can knock the door. They can use any kind of the signal to let them know that, okay, we need to prepare. The flooding will come soon. And this is also one of the things that we present into the Thailand government as well about this is the one that once we're talking about people with vulnerable, it doesn't mean that we can treat everyone the same. It doesn't mean that we have to do already the runway for the people who have physical disability, but also we have another characteristic of the people who have the vulnerable. And this is one of the things that we say that is the best practice when we show them on the intersectionality concept. Next slide, please. Next slide. Okay, thank you. And of course, once we have the best practice, the thing is we need to do is, actually it's not that they're very innovative, but we have to be ensure that we bring this up to make sure that policy driven understand and adopt or have the idea about what we are doing. We set up this kind of the brochure to ensure that the voice of the women and girls have been raised to the right place and right time. We ensure that we have the participate and bring the issue up to the people in the government to understand about that. And we ensure that once we're talking about the concern, we should come with together with evidence. We should not just come that, okay, women is concerned about that, but we need to have the evidence enough to support our arguments or our concern. This is the thing that we found many of time that many try, when the community try to raise this up, they just raise their concern, but they don't have the evidence backup. This means make their concern quite weak in the way of the authority as well. So that's why we try to make sure that they understand how to collect the information. They understand how to make it present not just only verbal present, but also we teaching them to do the kind of the infographic to make sure that when they present it present in a nice way. This is the new thing that I think. Thank
Sorry,
you.
can I ask everyone to be on mute, please? Thank you, sir. Sorry.
Okay, it's okay. Yep, I think this is next slide. Next slide, please. I think I come into the conclusion about when we're talking about innovative approach or innovative strategy. This is, we don't need to thinking about beyond what we are doing, but we try to thinking about how can we ensure that we bring the new concept, we bring the people in the community understand what they can do or what they should improve in that sense. And the concept of no one is left behind is one of the key concepts that we try to bring that from the last project. And of course, we will continue doing that and make it more comprehensive and it's more successful this year. Thank you so much, everyone. Thank you.
Thank you so much, Tom. The point that you raised about intersectionality and vulnerability is actually quite crucial to all of us, I thought. And thank you for highlighting that for all of us to think about. And I think that's a conversation that perhaps that we can pick up later in the webinar. I would like to now move on and invite Mia to comment on what are some of the key challenges that women and various vulnerable groups face when participating in disaster risk reduction efforts. Mia?
Yes, thank you. Hi, everyone. I'm Mia from YAKKUM Emergency Unit. To answer Remia questions on the key challenges that women and different vulnerable groups face when participating in disaster risk reduction efforts, based on what we do in the field with our community groups, one is of course gender inequality, which led to the exclusions or discriminations, but not only the inequality in gender, but also inequality for the other community groups, that minority, persons with disabilities, and also older people. This inequality and exclusions, of course, causing the systemic barriers, particularly for the grassroots women, for the persons with disabilities, older people, and other at-risk groups. The example of the systemic barriers are, for example, the limited access to information and decision-making roles, including making use of when they want to making use of the existing resources. These local grassroots communities are often ignored or overlooked, which then causing the failure in understanding the experience, their experience when there is a crisis or disaster or climate impact, and then it leads to the failure in addressing the needs of women and other at-risk groups. This gender inequality and other inequality in many sectors for these vulnerable groups and at-risk communities is usually also affected by the local cultural and social norms. In many societies, there are traditional roles and expectations that limit the involvement of women and marginalized groups. For example, in leaderships, in their existing social structures, they are not part of. the social structures, leaderships, and also in the community decision-making forums. Or they are part, but only like tokenisms, like they're only attend to listen or to accept the decision making made by other groups, which then causes the next challenges. There are exclusions from the designing, planning, implementing, monitoring, and finally evaluating the programs or the development efforts or initiatives happen in their area. So the like what mentioned before by the previous speakers and also in the introductions of the sessions, that disaster and the climate change tend to affect women and these at-risk groups more severely or disproportionately due to pre-existing barriers and inequalities. So for instance, women and other at-risk populations are more likely to lose their livelihoods and face longer recovery times. Yet they are largely excluded from shaping these disaster risk reductions and resilience policy strategies and programs. So they are not part of those mechanisms. The challenges are also coming from internally of these groups. So in forums and decision-making processes in the village, for example, these groups are having less self-confidence, so they also have less mastery of the issues and less capacity on how to convey their message in public, because they are not used to those forums and not used to speak in front of other majority of the population, for example. So these internal challenges added to with the external challenges is made them even less confident and then make them even more discriminated. Another challenge is in inclusions or inclusive DRR is also in many cases like what we mentioned before, their participation is just like ticking the box. So they are there, so we can tick the box and say that we already engaged them. So therefore, not many practical changes, let alone the strategic changes, happen based on the initiatives or actions that involve or engage them directly. So they are not part of those designing of the programs or the activities or the many planning, development planning in the locations in the village, for example. Their initiatives, their ideas, their needs are not then included in their development planning or any activities regarding the DRR and climate impact initiatives in the village or in other level. So many of them only participate as technical implementers and or recipients of these DRR programs. Thus, resulting in the resource constraints, they have limited access to financial resources and technology, and then they also still need further capacity strengthening, which is they are still lacking. So it restricts their ability to engage more in these efforts effectively. And then this access to opportunities and resources is often far from them, because there are many layers of systems and procedures, bureaucracy, that excluded them from being eligible participants in those existing opportunities, unless there are actors of organizations or the government that want to open and break down these layers of system and mechanisms and enable them to be part of it. More opportunities, more privilege transfers, and so on. So contributions made of these groups, they are actually made many contributions, like what Tom presented. Many local communities already have innovations and contributions that are very excellent and actually can be the solutions for the community. But these contributions made by the grassroots communities are also often overlooked and not really recognized by the decision makers in higher level. So those are very also big challenges. So for example, to conclude, there are intersectionality of these vulnerabilities with the challenges of poverty, gender, insecure rural livelihoods, or urban also livelihoods, and inadequate mechanisms to address the roots of the challenges, along with the experienced yet not understood impact of the climate change and disaster or crisis itself. So the understanding of the crisis impact and the climate impact in longer periods is also not yet there. So that remains as challenges also for these women, older people, and persons with disabilities when participating in the DRR. So I think those are that I can share for now. So Remia, over to you. Thank you.
Thank you, Mia. Thank you so much for your insights on the challenges that crop up over here. And you also raised the point about vulnerability, and that vulnerability is experienced and identified in so many different ways, which is definitely a point that we need to continue talking about and internalizing in all of the work that we do. There are so many barriers that you mentioned, but that could also perhaps be a channel where that opens up for us to be more creative and innovative in what we're doing. And that's the direction that we want to take the conversation to now. And I would like to put this question for Ms. Zulekha. And we heard from Mia about the challenges in the sector, but what are some of the actionable solutions we can implement to overcome these barriers? So if I can ask Zulekha ji to please make a comment.
Thank you so much. I lead the Gender and Child Cell at NDMA, which is the DMA National Disaster Management Authority in Pakistan. So Gender and Child Cell is the only such cell which deals with, caters to the needs and concerns of women, children, elderly, and the disabled. It was established in 2010 after the super floods in Pakistan. And National Disaster Management Authority Pakistan has the honor of having such a cell, which is the only cell in South Asia, which specifically deals with the vulnerabilities of vulnerable groups, specifically women. So taking it from there, a few actionable points, cardinal points that we work on is inclusive policy and leadership participation, which in turn leads to strengthening the legal and institutional framework. So we have a national policy guideline on vulnerable communities in which we have laid out the whole framework, and we have been working on that since it's been 15 years now. So including women in policy and leadership participation, we conducted the first national dialogue on the role that women and girls can play in disaster risk reduction and disaster risk management. It was last year, and we gathered policymakers, where women from the government side, women from the NGO sector, the humanitarian sector, and women from the grassroots levels from high risk districts which are prone to disasters on a regular basis. So they came together and we had a whole day dialogue, and women gave those recommendations that this is the role that we can play in a disaster, and this is how we can empower ourselves. And the recommendations that we got from that, we presented them at APMCDRR last year. So the next thing is we also work on gender sensitive risk assessments and planning. We have a gender and child cell dashboard, a portal that is comprised of GIS layers, which has all the gender and sex disaggregated data of Pakistan, or down to the tehsil level, down to the lowest level, union council level in Pakistan. So we know which district, which province has the number of population, the number of disabled people over there, the number of children, the number of elderly. So we collect that data and utilize it to inform our policy making and our response to any disaster. Even in early warnings, we have that. We strengthen our protection and response mechanisms through different working groups. Gender Task Force with UN Women, NDMA is the co-lead. The Gender Based Violence Working Group, NDMA is again a co-lead of that. And the Sexual Reproductive Health and the Protection Sector Cluster as well. So we also conduct capacity building and awareness campaigns. We currently are working on a model that AKKA is already doing in Pakistan. AKKA is the Aga Khan Agency for Habitat. They have a model of community emergency response teams, and they have all women emergency response teams as well, because considering the cultural environment of Pakistan, having an all women emergency response teams for evacuations and other response actions, women prefer that they are handled by women. So we are following that model, and we are currently working on raising the first ever female response team in the federal capital of Pakistan. We have conducted trainings on that. And in climate resilience and inclusive infrastructure, there is another very important program being run in Pakistan by the first female architect of Pakistan, where Yasmin Lari. Program is called Zero Carbon Campus, and she teaches women how to make resilient housing with bamboos. And that is a holistic program in which she teaches a village of 100 women how to build a flood resilient house in 2 hours. And then those 100 women go to another village.
Sorry, Zulekha ji, I think you're muted. Can you please unmute yourself?
Sorry, I'm really sorry for that. So, okay, so that is it. And a lot of efforts that we are doing is, strengthening the capacity building of our government stakeholders, because we are a federal authority. We work towards the capacity building of our government counterparts. Actionable, we are working on strategic actionable plans, because there is a lot of policy making. There are a lot of policy that are in place, that are on our bookshelves, that we don't even open. What we are doing now is working on actionable plans that we can actually work together and work towards the strengthening of women and their role in disaster risk reduction. Last year, we were in Nepal, where Gender and Child Cell was presented as a success story by UNICEF at the Knowledge Exchange by UNICEF ROSA, the regional office in Nepal. So, the one actionable plan that I presented over there was that at the Asia Pacific region, we should have a central regional cell which caters to the needs and concerns of women particularly, and other vulnerable communities. And we can take it from there, and looking at the current aid related issues around the world. So we should have our own Asia Pacific regional network, which caters to the needs and concerns of women and girls and other vulnerable communities with intersectionality, so that we can actually do something concrete in the region and for each other. So I think that is all from myself.
Thank you so much, Zulekha ji. You also mentioned data and dashboards, which is something Tom and Mia also brought in terms of when they said evidence as a backbone of having successful programs. This is another area that we can collectively collaborate on and open up pathways for co-learning. So, that is another conversation that we can continue to have. And I think thank you so much for all the panelists for sharing your valuable insights. We're at a point now where we can open up the floor for questions. So if anyone has any questions for the panelists, or if you would like to add your own experiences and insights into the points that we just discussed, please feel free to raise your hand, or you can also put your question into the chat box. So anyone with questions for any of the speakers?
I'm Madhavi Aryabandhu. Can I ask a question?
Yes, of course. Please, if you could just tell us about your organization and the work that you do.
I am from Duryog Nivaran, South Asia Disaster Risk Management Network, and my name is Madhavi Aryabandhu. Thank you for the presentations of actual life experience-based information, which is very interesting. I would like to know from the first presenter how now the anticipatory action has been recognized as a significantly successful early warning community preparedness measure to reduce the impact on particularly the marginalized community members. So has the project considered that option, and if yes, how, and if not, why not?
Can you repeat your question, the last question again?
Anticipatory action. Have you considered anticipatory action in your project interventions? And if you haven't, is that something that you intend to consider in future? Because anticipatory action is making the assessment, early warning, and based on that experience, empowering the communities to manage the situation before actual disaster happens, and providing them with the necessary support before the disaster.
Okay, so anticipatory action, I think is quite like a new concept as well. We try to bring that into practice, but at the area that we are working on, mostly is controlled by the authority or the government. They are the key person to raising that. The thing that we try to do is we try to bring the community who are in the area to be participate, to share their opinion to the authority about what they are doing is good or is not good, and what they should do or how can they improve this, by get the listening from every people in the community. Yeah, I think, is this correct that I answer your question?
To some extent, I suggest you actually take a look at the anticipatory action, what it means and how actually it can improve the community preparedness and response and reduce the impact at the community level.
Thank you so much.
Yes. Okay. Thank you.
Thank you.
Thank you. Thank you for your question, Madhvi. And we have May 4th here. And May 4th, please, if you could ask your question or make your comments. And please, of course, to introduce yourself.
Hi everyone. My question is for Mia, of course, my dear sister. She's talked about a bit about challenges for gender inclusive DRR, because also in the Philippines, we have also projects wherein a lot of women are very much involved in DRR. But the question is, do we have projects that would like husbands to be involved in supporting gender inclusive DRR? Because of course we've raised the knowledge and the skills of women so that they would know their rights, but doing that without the support of the husbands, it's also difficult. So do we have programs specifically for husbands for them to support gender inclusive DRI? Thank you.
Yes, can I answer now, Remya?
Yes, please do.
Yes. Thank you, Ate May, for the questions, my dear sister. So do we have a project that would like husbands to be involved? Specific projects is not, but we include men, whether they are husbands or the decision makers or other part of the leaderships in the community, to be part involved in the project design for women leadership strengthening. For example, in our DRR, some of our DRR, project participants, which are the women groups, the women farmer groups, or the women groups in the village, when they want to have certain initiatives on DRR in the village, they have to also collaborate with other existing social structures in the village. So how they do that? First, they have to approach also introduce their initiative to other structures which are dominated by the men, including their own husbands that sitting in the decision makers in the village. So they need to be also part of the dialogues with them, and also session. So we facilitate them to be have confidence, and then they are the one that speak directly in those forum with the men. And so before this, the women have the dialogues, we have the stakeholders meeting when of the projects or the activities, why importance of the leaderships of should be done first before these women can speak directly with the men in front of the men. So those are the steps that we also taken to enable the women. So like building the environment first, so the women is also ready to speak before the men, because in many of our rural grassroots women, the confidence itself is not there, because they are not like what we mentioned, we're not get used to speak in front of public. Even at the household level, in domestic sphere, for example, in patriarchal communities, like we know, women are not the decision makers. So it should be in both sides. Also, women strengthening the capacity of the women, but also approaching the men. Also, maybe engaging them in activities, and also be part of the dialogues is also important for both gender. Hope that answer to your questions, Ate. Thank you.
Thank you very much, Mia. Yes, you did answer the question, and I think we have similar experience that we really have to involve the men, no? And maybe next time we can make some program that purposively we really involve them so that the result is more efficient and effective. Thank you very much, Mia. Thank you, Remya.
Thank you. Thank you. Thank you.
We have Ikwe here with us. So Ikwe, do you want to introduce yourself and then ask your question?
Yeah, thank you, Remya. And everyone, I'm Ikwe, based in Japan, and then I'm from CWS Japan, and then also serves as innovation hub staff for ADRRN. And then I really appreciate this session because it gives me an opportunity to really understand the landscape of gender and DRR in this region. And my question is to Tom. And then I understood that the one of the objectives of that project was to protect victims of gender-based violence and domestic violence. And I find this area very challenging because I'm also doing a research on the domestic violence and then child abuse in Japan. And then, I think it may force the question about the husband who is not indifferent, and not so much enthusiastic about the initiative. But this gender-based violence and domestic violence, it sometimes it's related to coercive control. So the perpetrators, purposefully control the victims, and then that system is very difficult to intervene into. So I am very curious how you address, those family ecology or the social ecology, and then in relation to the the disaster risk reduction. I understand this is a very challenging area anyway, so I don't expect any a clear-cut solution, but I would really love to hear your insights and learnings. Thank you.
Okay, so thank you for the question. And yes, this is quite challenging question and also challenging work to do on the domestic violence. So the thing that we are doing right now, we do in the two sides. First, in the side of the women, of course, I mentioned we try to empower them. We try to let them know that how power they have, and how should they can be the women who understand about the domestic violence. The first thing that we found that in Deep South is many women, they didn't know that the thing that they found, they face is already domestic violence. already disturbing them. They still that this is the culture, this is the religion and culture block them to accept that this is a domestic violence. And the thing is quite challenging because we try to make them understand. At the same time, we have to be harmoniously and understand about their culture and their belief. This is one of the challenge. And at the same time, we're working with the men as well to provide them about what's the right of the women, how benefit if the domestic violence is gone, is not there. And also we have to give them about what the law talking about. In Thailand, we have the Domestic Violence Act, we have criminal law. So we need to give them like a carrot and stick at the same time. We give them what is the benefit, and we give them what the impact if they're doing on that. And also we working together with the women organization in Deep South to set up the center for counseling for the women, because we found that to make women in that community counseling to the women in their own community, they have more understanding. And the way that we do is we build up the capacity of the volunteer to understand about what is the concept of domestic violence, what is the law, and how can they communicate or connect with the authority in case that we need to rescue those people who face this kind of the violence. Particularly during the disaster, we found that the domestic violence is increased but not reporting. Because with the culture, with the situation, they have more about violence happen, but mostly of the violence is about mentally violent. It's not physical. This is the thing that we try to make is like a bit by bit. It's quite challenging. It takes time to change the perspective of the one person. It takes time. We can find some kind of the practice or the family to be what do you call example, the best practice to show to the community. However, it still takes some time to develop, but we on the way. At least we know how to go there. We working together with the local community, or we working together with the women organization to understand the context. Yeah, I think this is the thing that we are doing now. I hope that my answer will be give some clue. I know that it's not the best answer, but it's the thing that we try to do right now. Yeah.
Yes, thank you very much. I learned a lot, and I particularly like the idea of community volunteers, because in this area the laws can do only the limited the work. So the peer supporters in the community, I think it's powerful. Thank you very much.
Thank you.
Thank you, Tom, and thank you, Kwe, for your question. Madhavi, you have a question?
Yes, thank you for another opportunity. I would like to ask, sorry, I didn't catch the name, the Gender and Child Cell, NDMA Pakistan.
Zulekha.
Zulekha, yes. I would like to ask you, I mean, it's quite impressive that you said that you have different working groups like gender-based violence and National Disaster Management Authority is part of those working groups. So we also heard from the other speakers that engaging women and marginalized groups is challenging because of the other socio-cultural issues. They are not forward, they are not familiar about expressing their problems, they don't come forward to speak. So how do you manage to, I would like to know, how do you manage to involve the women, particularly women, who are at the community level in these working groups? How do you actually get women to, engage, speak out, be part of the planning processes? So what is your model? Any examples? I would very much appreciate if you can share.
Thank you so much. So, as we are part of the Federal National Disaster Management Authority, so our jurisdiction is only at the federal level. in Pakistan, it's the National Disaster Management Authority. That is the third tier. The first tier is the provincial disaster management authorities and the district disaster management authorities. But as the national body, we work with different humanitarian partners, and with different humanitarian partners, we have all these working groups. The working groups are basically comprised of all the government bodies, the government departments that are dealing with women, children, the Human Rights Ministry, the National Commission on the Status of Women, the National Commission on the Rights of the Child, the National Commission on Human Rights, and others, and the UN agencies working in the humanitarian sector in Pakistan, the INGOs working in Pakistan, and the NGOs. What we yes, this is a challenge of engaging women from the grassroots levels, women from the communities, to come up and to air their problems, to voice their problems and their own solutions, so that they can take care of their own futures. So that is why I gave the example of the first national dialogue that we held last year, in which we brought all these women, which different organizations had been working with over the years. Those women were brought in Islamabad, from all over Pakistan, from all the provinces, from the most marginalized areas. And they were given an opportunity to sit down with the policymakers, the government bodies, the humanitarian sectors, the UN agency, gender advisors, and air their problems and give their solutions. So we came up with a robust plan which actually cater to the SFDRR priority areas, and we matched their recommendations to those. And that I gave the example that we presented in APMCDRR in Manila in October last year. So in Pakistan, because Pakistan is a disaster-prone country, people are becoming very aware of that these disasters occur on a regular basis. Uh, because Pakistan is majorly the northern areas are earthquake prone, glof prone. So those areas, they know. ACA is another example, the Aga Khan Agency for Habitat and the Aga Khan Agency for Development, the Aga Khan Development Network. They have the community emergency response teams. Those are actually women from the community who are voluntarily working as emergency response team members, and they provide trainings to other emergency response teams, and they actually do evacuations, respond to emergencies in a situation like glof or landslides or avalanches, which are particular to that region. The plains of Pakistan are flood prone, and they are historically flood prone, so people know that in this time period of the year we are going to be hit by a flood. So actually in Pakistan, people are a lot aware. And now, due to the social media and its presence all over Pakistan, women are more vocal, and they want to be included in these discussions, and they want their voices to be heard. So whenever we or our provincial counterparts go into the field, our humanitarian sector counterparts go into the field, women come forward, air their issues, and let us know what they need. Gender-based violence, we have referral pathway mechanisms in Pakistan, and yes, women are coming forward. A very good example is the Provincial Disaster Management Authority of the Khyber Pakhtunkhwa province, where there is a helpline which is manned by women, and which is kept, the details are kept confidential, and the success rate of that helpline is remarkable. Although I can't share the numbers, but it has been quite it is a flag bearer program for PDMAKP, and it is a success story on their part. So hopefully I've answered your question on that.
Thank you, Zulekha ji. We also have a question from Sarah. So Sarah, if you could introduce yourself and ask your question.
Yes, I hope you can hear me. I am a student, actually a master's student in disaster risk reduction and climate change adaptation in Sweden. And I have recently worked a bit with MSB, which is the Swedish Civil Contingency Agency. And we were talking about, and my question kind of goes for all the panelists, and it's about when including women and empowering them to work within disaster risk reduction, sometimes they can have the negative effect of perhaps overburdening them because they are already taking on a lot of work, especially invisible work that sometimes is not recognized. So especially in the reproductive labor. And I was wondering if anybody had the experience of how we can balance perhaps between including women in disaster risk reduction initiatives, but also making sure that we are not overburdening them with extra work that they might already be doing, etc.
I think this question is open to any of the panelists or even anybody else in the group. If you want to comment on it, please feel free to do so. Thanks for your question, Sarah. Takeshi?
I would love to. Yeah, I would love to hear. Thanks for the question, and I think it's a great question. I would love to hear this from our panelists also. But what I've been learning through these locally led innovation, locally led solution building is, we don't expect these women or anyone from the community to join us in our terms, so to say. I think providing a space for them to think and plan and implement their solution in the way that is most appropriate in their context is probably key in enabling their leadership to flourish to the fullest extent. And I see that happening with our colleagues, say, Mia represents YEU, May 4th represents CDP. They implement these locally led, community-led innovation programs, and they really do give that space to the community. So I think it's important for us to realize, as external agencies, we don't go in and say, join us in our terms, but it's really about giving that process and ownership to them, I think. But open to the panelists.
Thank you, Takeshi. Tom, would you like to add to that?
Yes, I think I'm not. I don't want. I don't have the answer, but I have maybe another challenge as well, because in the deep south of Thailand, when we're talking about we meant to be involved with the DR. We, like Takeshi said, we don't force them, but normally those people willing to do, and they didn't realize that how much work they handle. They didn't realize how straight they have. They always said, "Oh, of course, I want to do, I want to do, I want to do." And once we come up to at the kind of like a reflection section with them, and they start crying, they start show their emotional. That is the thing that, okay, this is very important that we need to be very careful about that. I don't have the proper answer to this question yet, but the thing that we do is we try to connect them to talking or to have the section to release what they are feeling, or the basic PSS, basic psychosocial support for them. This is the thing that we do. And I would love to listen from others as well, because the problem is not about they don't want to do and we force them to do. The problem is they really want to do, but they don't know that how much they can handle and how they can handle with that. This is the big problem that we found. Thank you.
Thank you, Tom. I'm aware of time, and we just have a few minutes to go before we have to close the webinar. But Mia, I think you had your hand up if you just want to make a quick comment on this.
Thank you, Remya. It's almost similar with the previous speakers, but like what Takeshi mentions, that the designs of the activities is designed by themselves. So, for example, for our local grassroots women innovators, they are the one that come up with the solutions and starting from the designs of the innovation itself up to the when they want to do this, when the meeting schedule, up to the how they divide the work between them is up to themselves. So we only assisting and facilitating the process, but they are the one that in charge in decision making on what they want to do with the process of the innovation development itself. It's similar also in other projects when the women themselves are decided on when and how they want to develop their initiatives on DRR or preparedness or climate impact adaptations. And for the external factors that for example their family, their husbands, or the other local communities that are still in traditional conventional communities where women are restricted, there are dialogues with them why women need to do this, and please give them also space and understanding the needs that it's not only give the benefit to the women themselves but also the whole communities. So approach to the not only to the women like what when we answer the method questions, but also approach to the whole community itself. So not only strengthening the women, but by strengthening these women groups, we also strengthening the capacity of the community themselves, because they are also part the ownership, even though it is led by the women, but the impact or the benefits of these initiatives are also reach their communities, and the nearest community of the women are of course their family. So by understanding these domino effects of the benefits of the initiatives, the community gradually understand and support. Even now they are willing to also contribute to the women's groups activity and initiatives and give them space to grow also. So hopefully that also answer to your questions.
Yeah, thank you.
Ramona, you have your hand up, please.
Yeah, so just trying to bring a few things together, just my thoughts on listening to all of you. A lot of the sites on the International Women's Day has talked about the fact that data is showing that it will take roughly 5 generations to reach gender parity. So it also talks thus we need to accelerate action. So we have heard some very interesting speakers shared, listened to some of the really good experiences of what has been done, what needs to be done as part of a network of a stakeholder group advocating, as part of a network and of a stakeholder group advocating for gender responsive development and DRR. What can I emphasize or reiterate? I think we need to keep talking about the wealth of knowledge that women possess in matters concerning their own communities. We've talked about it quite a bit today. We need to provide opportunities for women leaders, the innovators, the solution providers, the different groups to speak up, as many of our speakers highlighted. We need to help build an active layer of female representatives at the local level of governance. This then will build the confidence to increase the numbers at national level, right? So this requires removing barriers, accepting the role women can play, removing the, improving readiness of the governance systems. And we need to keep lobbying against policy decisions that do not reach women or represent their experience of needs. We need to lobby to engage women in the decision-making process, not just in governance, but also in the workforce. Because recognizing and making women a key driver in the labor force will enhance their economic empowerment, legitimacy, self-autonomy, agency, and also ability to make decisions in the household also. Then we talked about data, gender analysis, use gender analysis planning and programming. We need to lobby for budget allocations, for safeguarding mechanisms for such as insurance schemes, healthcare systems, destigmatizing the reporting of gender-based violence, and improving facilities to improve gender-based violence. We need to also sensitize future generations that the psychological burden on multiple responsibilities that women face within households needs to be understood, acknowledged, and changed. And we have many tools that are available to us. The Sendai Gap, that is the Sendai Gender Action Plan for responsive, gender responsive DRR. Let's use that work in our for our lobbying. And one of the biggest challenges is the lack of acceptance of the relevance of gender responsive development and resilience building. But if we continue to point it out, if we continue to work collectively, hopefully by 2030, things will be a lot different. Thank you.
Thank you, Ramona. And I agree that this is definitely a conversation that we all need to continue having, and really not just around International Women's Day, but throughout the year and continuing forward. So we are very much nearing the end of the session that we had planned. I'm going to request if we could have a quick photograph, a screenshot. So for that, if all of you who are comfortable with it, could just turn on your camera, and then we will have a final closing session. So, and Aswani, if I can request you to take the screenshot.
Can we also make that sign assigned like this?
Which sign?
Yeah, this is the sign. All of us.
Great. Aswani, you'll have to let us know when the pictures are done.
Yeah.
Otherwise, you'll be standing like this sitting like this for a long time.
Just one more. One screenshot is done. Just one more.
Yes, I hope you've got it. Thank you, everyone. Thank you so much for being part of this discussion. And I would now like to invite Kathy, who's the project director at International Rescue Committee Asia, to give a closing remark and to summarize our discussions today. Thank you, Kathy.
Oh, thank you, Ramya. It's a bit difficult to summarize the discussion, but on behalf of the project, Strengthening Inclusive Disaster Risk Governance for Climate Resilience in Asia, or what we fondly call CIDRA, and on behalf of its consortium partners, our appreciation to ADRRN colleagues for really taking the time to organize and coordinate this webinar. Also, a huge thanks to our panel members, YEU Indonesia, IRC Thailand, and the NDMA of Pakistan, for sharing your experiences, challenges, and inspiring insights. And I really like the call to actions. So in addition to Ramona's very clear recommendations and marching orders on what we should do next, let me quickly share what I learned, or rather relearned, from this webinar. I think I have five points. Number one, I really like Ramya's points about pointing to us that problems and challenges drive innovations. And that is why the people that are really impacted with all this are best positioned to lead the change. For some of us, this is just a project, but for them, it's their reality, it is their daily lives. And going back to Takeshi's point on ownership, this is theirs, this is their lives, and we are just supporters or enablers or bridge of the process. Second, I think that women and girls, persons with disability, elderly, and other vulnerable and at-risk groups have been proving time and again that they can be an active agent of change. You've seen that in the videos, we've heard a lot of examples. And they're not just beneficiaries and recipients of aid, really transforming gender roles and barriers. I really like Pakistan's experience of the first women architect who are paving the way on building climate resilience infrastructures. So really amplifying those examples that are really transformative for some cultures. It might be normal for other cultures, but it might be a change for others. So those kind of contexts. Third, as a movement, we need to create more, bigger, broader, louder platforms to amplify gender and intersectional realities and solutions driven by the voices of communities, women and girls organizations of people with disability and other vulnerable or at-risk groups. Because we really need to strengthen our storytelling and evidence gathering to support the work that we're doing and bring this into the policy level to somehow bridge that policy and practice gap that we are all seeing. Fourth point, this is a reminder to me that while we appreciate and advance the use of technology, and science, in disaster governance, I don't know, anticipatory action, adaptation initiatives. Let us also bring back the focus and premium to the importance of grassroots practices and local knowledges, because by doing so, we also highlight and recognize local leadership, which is also key in the work that we're doing. And lastly, I think we've been hearing a call to really broaden and strengthen our multi-stakeholder partnership and leadership. And in bringing these governance avenues down to the ground to lessen the gap. So at this time, I think it is really inspiring to have these lessons and call to actions close to our sleeves and close to our hearts, especially during these times. Because personally, I think we are at that point where our work is more valuable than ever. Ramona mentioned that it will take 5 generations to close the gender parity, but without the reversals in policies and practices, but factoring that in, I'm not sure if it could take more time than that. So personally, I really, and let me share this very brief quote and experience or anecdote. I would say that a few days after Trump signed the executive order ending the, quote, radical and wasteful government DEI programs and preferencing, unquote, which was immediately followed by the suspension of foreign development and humanitarian aid, IRC posted a quote from former President Jimmy Carter, reminding us to adjust to adjusting times or adjust to changing times, but still hold to unchanging principles. So I think to me that is a rallying and a battle cry, but I know that it is easier said than done, especially when our core programming, which reflects our core principles, are being challenged and put into questions at this difficult time. So the basic principle of recognizing diversity and intersectional identities, gender and climate justice are now under attack. So we are doing this not as individual organizations and networks, but really through a consortium of very strong networks and organizations composed of ADRRN, Duryog Nivaran, IRC, and the Philippine Business for Social Progress. And we are standing in solidarity and holding a space where communities and at-risk groups, particularly women and girls, can not only participate, hopefully, and write their names on attendance sheets, but really, truly lead in identifying issues and drive solutions. So happy International Women's Day, everyone. And on behalf of the consortium, we hope to see you again at our future webinars, where we can introduce further what we're doing and the consortium partners as well. And thank you all to the 50 plus, now 40 plus participants choosing to join us this Wednesday morning or afternoon. Thank you, Ramya.
Thank you so much, Kathy, and thank you everyone who participated today. And as is mentioned today, this is a conversation that needs to keep going, and this won't be the last of the conversations of the webinars that we'll be organizing. And yes, with that, happy Women's Day. I hope all of you have a great weekend, and let's keep the conversations going. Thank you very much. Thank you. Bye.
Thank you.
Thank you.
Bye.
Bye.